Over the last few years, you've probably heard names like Ozempic, Wegovy, and Mounjaro everywhere. Celebrities are talking about them, social media is full of dramatic before and after photos, and millions of people around the world are now using these medications for weight loss. Some people call them miracle drugs, while others warn about serious side effects. So what's the truth? In this video, we're going to separate facts from myths. We'll explain how GLP-1 medications actually work, who they are designed for, how much weight they can help people lose, their most common side effects, the rare but important risks you should know about, and what happens if you stop taking them. By the end of this video, you'll have a clear understanding of whether these medications are right for you, or at least enough knowledge to have an informed discussion with your healthcare provider. Let's start with the basics. GLP-1 stands for glucagon-like peptide 1, a hormone that your body naturally produces after you eat. Think of it as one of your body's built-in appetite regulators. When food enters your digestive system, GLP-1 sends several important signals throughout your body. First, it tells your pancreas to release more insulin, which helps lower blood sugar levels after meals. At the same time, it reduces the release of another hormone called glucagon, which normally raises blood sugar. It also slows down the emptying of your stomach, meaning food stays in your stomach longer, helping you feel full for a much longer period. Finally, and perhaps most importantly for weight loss, GLP-1 sends signals to your brain that reduce hunger and increase feelings of fullness. The result is surprisingly simple. You feel satisfied with smaller meals, you snack less often, and over time you naturally consume fewer calories. That reduction in calorie intake is one of the main reasons these medications are so effective for weight loss. Interestingly, these drugs were never originally created for obesity. They were first developed to treat type 2 diabetes because of their ability to improve blood sugar control. But during clinical trials, researchers noticed something remarkable. Many patients were losing significant amounts of weight. That unexpected finding completely changed the future of these medications and led to a new era in obesity treatment. Today, there are several GLP-1 medications available, but they are not all the same. Ozempic and Wegovy both contain the same active ingredient, semaglutide. The main difference is their approved use and dosage. Ozempic is primarily approved for treating type 2 diabetes, while Wegovy is specifically approved for chronic weight management. Then there's Mounjaro, also known by its generic name tirzepatide. This medication works a little differently. In addition to activating the GLP-1 receptor, it also targets another hormone receptor called GIP, or glucose-dependent insulinotropic polypeptide. By stimulating both pathways, tirzepatide has produced even greater weight loss in clinical trials compared with many earlier medications. Researchers are already working on the next generation of treatments. New medications such as orforglipron, an oral GLP-1 pill, and retatrutide, which targets 3 different hormone pathways at once, have shown very promising early results. Some studies have reported weight loss approaching 30% over approximately 2 years, although these newer medications are still being evaluated. It's important to understand that none of these medications work like magic. Every major clinical trial combined the medication with healthy eating habits and regular physical activity. These drugs are designed to support lifestyle changes, not replace them. Now let's talk about side effects, because this is one of the biggest concerns people have. The good news is that most side effects are related to the digestive system and are usually mild to moderate. The most common include nausea, vomiting, diarrhea, constipation, bloating, stomach discomfort, and reduced appetite. These symptoms are especially common during the first few weeks of treatment or after increasing the dose. This is exactly why healthcare providers start patients on a low dose and gradually increase it over time. This slow dose escalation gives the body a chance to adapt and significantly reduces the likelihood of severe gastrointestinal symptoms. For many people, these side effects gradually improve over several weeks. However, there are also some rare but potentially serious risks that everyone should know about. One of the most important is acute pancreatitis, which is inflammation of the pancreas. Fortunately, this complication is uncommon, but it can become life-threatening if it isn't recognized early. The warning signs include severe, persistent pain in the upper abdomen, especially if the pain spreads to the back and is accompanied by nausea or vomiting. Anyone experiencing these symptoms should stop taking the medication and seek immediate medical attention. Regulatory agencies have identified pancreatitis as a known but infrequent risk associated with GLP-1 medications, and researchers continue to study exactly why it occurs in some individuals. Another topic receiving increasing attention is muscle loss. Whenever people lose a significant amount of weight, they typically lose not only body fat but also some muscle mass. Studies suggest that a meaningful proportion of weight lost while using GLP-1 medications may come from lean muscle tissue. This doesn't mean the medications are damaging muscles directly, but it does highlight the importance of protecting muscle during weight loss. The best strategy is to consume enough protein every day and include regular resistance exercise, such as weight training or body weight exercises. These habits help preserve muscle while maximizing fat loss. People also ask whether GLP medications weaken bones. Weight loss itself can reduce bone mineral density over time, regardless of how the weight is lost. Interestingly, some early evidence suggests GLP-1 medications may actually reduce some of the negative effects of weight loss on bone health, but researchers are still investigating this question. Another area of ongoing research involves eye health. Some reports have suggested a possible association between GLP-1 medications and certain eye conditions, particularly in people with diabetes. However, current evidence is not strong enough to conclude that these medications directly cause eye disease. More research is needed before any firm conclusions can be made. Now let's discuss pregnancy because this is extremely important. GLP-1 medications should not be used during pregnancy. Although human data remain limited, animal studies have suggested that these medications may harm a developing fetus. For this reason, women taking GLP-1 medications are advised to use effective contraception. If you're planning to become pregnant, you'll also need to stop these medications before trying to conceive. For semaglutide, treatment should be stopped at least 2 months before pregnancy. For tirzepatide, the recommended washout period is 1 month. Liraglutide has a much shorter elimination time and does not require the same prolonged washout period before pregnancy. These medications are also not recommended while breastfeeding. One question that almost everyone asks is, what happens if I stop taking the medication? The answer is straightforward. Obesity is a chronic disease, not a temporary condition. Just as blood pressure often rises again after stopping blood pressure medication, body weight frequently increases again after discontinuing GLP-1 therapy. Research has shown that many patients gradually regain weight after stopping treatment, especially if healthy lifestyle habits have not been established. That's why experts emphasize that nutrition, physical activity, and long-term behavior changes are just as important as the medication itself. The medication can help initiate weight loss, but maintaining that weight loss requires lasting lifestyle changes. Finally, who should actually use these medications? GLP-1 medications are generally intended for people living with obesity or those who are overweight and also have weight-related health conditions such as type 2 diabetes, high blood pressure, or cardiovascular disease. They are prescription medications that should be used under medical supervision. They are not designed simply to help someone lose a few cosmetic pounds before a vacation or special event. So what's the bottom line? GLP-1 medications represent one of the biggest advances in obesity treatment in decades. They have helped millions of people lose meaningful amounts of weight while improving blood sugar control and reducing the risk of several obesity-related diseases. But they are not miracle drugs. They work best when combined with healthy eating, regular exercise, and ongoing medical care. Like all medications, they come with both benefits and risks, and the decision to use them should always be made together with a qualified healthcare professional. If you found this video helpful, consider sharing it with someone who has questions about weight loss medications. And if you'd like more evidence-based medical content explained in a simple and practical way, don't forget to subscribe.